Welcome to the Pharmacology Series, where we explore the intricate science of drugs and their effects on the human body. In our last video, we discussed the critical topic of drug metabolism, delving into how the body processes and transforms medications. Today, we take a step further into the realm of precision medicine with a focus on pharmacogenomics, the intersection of genetics and drug therapy. This fascinating area examines how genetic differences influence drug response, paving the way for personalized treatment strategies. Before we dive in, don't forget that there's a dedicated video quiz with 10 multiple-choice questions for this topic, available on this channel. The link to the quiz will be provided in the description below. Let's get started. Pharmacogenomics is the study of how genetic variations influence an individual's response to drugs, bridging pharmacology and genomics to advance personalized medicine. This field is pivotal in optimizing therapeutic outcomes and minimizing adverse drug reactions, with real-world applications in tailoring treatments for diseases like cancer and cardiovascular disorders. According to the World Health Organization, WHO, adverse drug reactions are among the top 10 leading causes of mortality worldwide, underscoring the necessity of pharmacogenomics in global healthcare. In this lecture, you will explore the foundational concepts of pharmacogenomics, its clinical implications, and how genetic testing can improve drug safety and efficacy. Let us now outline the key learning objectives to guide our exploration of this cutting-edge topic. By the end of this video, you'll gain a comprehensive understanding of the following: how genetic variations influence drug metabolism and the mechanisms behind these effects. The role of specific genes and polymorphisms, such as those affecting CYP enzymes, in drug response. Clinical applications of pharmacogenomics in tailoring therapies for individual patients. Examples of adverse drug reactions linked to genetic factors and how these can be mitigated. Ethnic variability in genetic polymorphisms and its implications for pharmacotherapy. The future of pharmacogenomics and its role in advancing precision medicine. Understanding pharmacogenomics equips clinicians with tools to predict these reactions and tailor treatments to individual genetic profiles. This enhances both efficacy and safety. For instance, a genetic test can determine whether a patient is likely to benefit from a cancer therapy or is at risk of severe toxicity. This approach not only improves patient outcomes but also reduces healthcare costs associated with trial and error prescribing. Now, let's explore the foundations and clinical implications of pharmacogenomics in more detail. Pharmacogenomics investigates how genetic variations, such as single nucleotide polymorphisms, SNPs, and structural genetic alterations, influence pharmacokinetics and pharmacodynamics. These variations can alter drug metabolism, efficacy, and safety, enabling individualized treatment strategies. For example, polymorphisms in the CYP2C19 gene affect clopidogrel metabolism, reducing its activation and increasing the risk of thrombotic events in certain individuals. This genetic insight optimizes therapeutic outcomes while minimizing adverse effects. Let's look at genetic polymorphisms. Genetic polymorphisms significantly impact the function of enzymes, transporters, and receptors, altering drug metabolism, efficacy, and toxicity. A prime example is CYP2D6, an enzyme responsible for metabolizing approximately 20% of clinically prescribed drugs, including codeine. Variations in CYP2D6 genes result in poor metabolizers, who may experience therapeutic failure, or ultra-rapid metabolizers, who are at risk of drug toxicity due to elevated active drug levels. These polymorphisms underscore the need for personalized medication strategies to optimize therapy. We want to take a closer look at genetic variation in codeine metabolism. Codeine is metabolized in the liver by the CYP2D6 enzyme into its active form, morphine, which provides analgesic effects. Poor metabolizers have reduced CYP2D6 activity, leading to insufficient morphine levels and inadequate pain relief. Conversely, ultra-rapid metabolizers have heightened CYP2D6 activity, resulting in excessive morphine levels that significantly increase the risk of opioid toxicity, including life-threatening respiratory depression. These polymorphic variations in metabolism underscore the importance of pharmacogenomic testing in individualized pain management. Transporters and drug disposition. Transport proteins, such as SLCO1b1, play a pivotal role in the hepatic uptake and systemic clearance of drugs. Genetic polymorphisms in the SLCO1b1 gene can significantly alter transporter function, leading to variability in drug exposure and therapeutic outcomes. For instance, SLCO1b1*5 polymorphism reduces statin uptake into the liver, increasing systemic drug levels and the risk of statin-induced myopathy. Clinical management may require dose modifications or switching to non-SLCO1b1 dependent statins like fluvastatin. Immune system genes and adverse drug reactions. The immune system plays a pivotal role in adverse drug reactions, with genetic polymorphisms like HLA-B5701 strongly associated with hypersensitivity reactions to abacavir. This hypersensitivity manifests as a potentially life-threatening immune response, including fever, rash, and organ involvement. Screening for HLA-B5701 before initiating abacavir therapy minimizes risk by identifying at-risk individuals. This approach underscores the importance of pharmacogenomics in tailoring therapy to enhance safety and efficacy in drug prescribing. Another genetic polymorphism that can potentially lead to hypersensitivity reaction is for carbamazepine. Pharmacogenomics in carbamazepine therapy has revolutionized patient safety by identifying genetic predispositions to severe adverse reactions. The HLA-B*15:02 allele is strongly associated with Stevens-Johnson syndrome, SJS, and toxic epidermal necrolysis, TEN, life-threatening dermatological conditions. Pre-treatment genetic screening is crucial, especially in individuals of Asian descent, where this allele is more prevalent. This personalized approach minimizes the risk of these fatal outcomes, ensuring safer and more effective carbamazepine therapy. Genetic testing for CYP2C9 and CORC1 polymorphisms is pivotal in optimizing warfarin therapy. Variants in CYP2C9 can reduce the metabolic clearance of warfarin, while CORC1 variants alter the drug's target sensitivity. This pharmacogenomic approach minimizes the risk of over-anticoagulation leading to hemorrhage or under-anticoagulation resulting in thromboembolic events. For example, patients with CYP2C92 or CYP2C93 alleles often require lower warfarin doses to achieve therapeutic efficacy safely. Trastuzumab, a monoclonal antibody, commonly known by its brand name Herceptin, is pivotal in the treatment of HER2-positive breast cancer, a subtype identified through genetic profiling of the HER2/neu gene. Overexpression of this gene predicts responsiveness to trastuzumab, which inhibits HER2-mediated cell proliferation. This precision-targeted therapy exemplifies the role of pharmacogenomics in personalizing cancer treatment, improving efficacy while reducing off-target effects. Genetic screening is crucial to identify patients who will benefit from trastuzumab therapy. Just to summarize clinical application of pharmacogenomics, let's look at this table. This table highlights the practical applications of pharmacogenomics in clinical medicine. Each drug listed exemplifies how genetic testing can optimize therapy. For example, warfarin and clopidogrel require testing to ensure safe and effective anticoagulation, while codeine testing prevents serious side effects in patients with varying CYP2D6 activity. Carbamazepine and abacavir rely on HLA testing to avoid life-threatening reactions. In cancer therapy, irinotecan metabolism is guided by UGT1A1, and trastuzumab works only in HER2-positive cancers, emphasizing the need for precise targeting. Lastly, azathioprine testing ensures safe immunosuppression by avoiding toxicity. This summary underscores the transformative role of pharmacogenomics in tailoring treatments to individual genetic profiles, improving safety and therapeutic outcomes. Ethnicity and genetic variability. Genetic polymorphisms exhibit marked variability across ethnic groups, significantly influencing drug metabolism and response. For instance, ultra-rapid metabolizers of CYP2D6 are more common in African and Middle Eastern populations, leading to altered efficacy and toxicity profiles for drugs like codeine. Similarly, as indicated above, East Asian populations have a higher prevalence of HLA-B*15:02 alleles, which heightens the risk of Stevens-Johnson syndrome when taking carbamazepine. Understanding these differences enhances precision in pharmacotherapy across diverse populations. The future of pharmacogenomics in precision medicine lies in its ability to tailor drug therapies based on individual genetic profiles, optimizing efficacy and minimizing adverse effects. For instance, pharmacogenomic testing for CYP2C19 variants guides the use of clopidogrel in patients with acute coronary syndrome, ensuring effective platelet inhibition. Advances in genome editing technologies like CRISPR may enhance drug development, while integration with artificial intelligence, AI, could refine predictive models for drug responses. These innovations promise a paradigm shift in personalized healthcare. Now that we've explored pharmacogenomics, let's take a moment to recap. We've covered genetic variations in drug metabolism and transport mechanisms, specific gene-drug interactions, such as CYP2D6 and HLA-B polymorphisms, how pharmacogenomic testing enables personalized therapies for safer, effective treatments, adverse drug reactions linked to genetic factors and their mitigation, ethnic variability in genetic polymorphisms and its pharmacotherapeutic implications, the future potential of pharmacogenomics in advancing precision medicine. Conclusion: mastering pharmacogenomics is essential for clinicians and students navigating modern pharmacology. Check out our next video on Introduction to Autonomic Pharmacology, exploring the autonomic nervous system and its pharmacological modulation. For further reading, we recommend Rang and Dale's Pharmacology and Goodman and Gilman's The Pharmacological Basis of Therapeutics. If you found this video insightful, give it a thumbs up and subscribe to our channel for more in-depth explorations of pharmacology. Share your thoughts or questions in the comments section, we'd love to hear from you. Thank you for watching, and we'll see you in the next video.